We got Dr. Dan Kalla, international bestseller and previous head of emergency medicine at St. Paul's Hospital with affiliations of the University of British Columbia. Dr. Kalla has committed his life to emergency medicine and has now written over 10 novels in the medical thriller genre, one of which, The Last High, I've personally read myself. I'm on chapter 13 and it's it's amazing. I'm really enjoying it. I wanted to look back and ask you what kind of got you into medicine. Like when you started your undergraduate degree, like I understand you, from my understanding, you went to UBC for med school.
Yep.
So where did you do your undergrad and what inspired medicine? Like, did you always know that you were going to do that or?
Yeah, well, medicine was kind of my family legacy. I'm a third generation doctor. You can't swing a dead cat at my family reunions without hitting a bunch of doctors. So it was something I always expected to do and thought about. And back in ancient history, when I went to med school, it was a bit easier to get into. I don't think I would get in now, but yeah, so it was something that I, sort of had in my blood, as it were. And I'm so always worked towards in high school and undergrad. Just thought my parents were both doctors and they inspired me. And so
it's your calling for sure. Yeah, growing up with that for sure. So what did you do for your undergrad? Like, how did you start your schooling?
Well, I got, it's funny. I was in engineering for a day, my first day, and I transferred. When I saw how long the hours were going to be at that, I said, no, I'm not.
Yeah, no thanks.
And so I just tried and transferred to general sciences. And then I was a chemistry major for the first year. And when I saw all the labs, how crazy they were, like 5 days a week, long days, I switched to math. And that was like a dream because it was like, A, it was probably my best subject. And B, it was 3 days a week for like 3 hours a day. I had the dream schedule and the end second year and third year. And so, yeah, and I applied. I went into med school relatively young. Back then, you could get in after 3 years.
Okay.
And so I did that. I did end up finishing my math degree during med school. I just wanted my BSc, so I only had a couple courses to do. So I did that, but yeah.
Definitely. Good for you. Now that we've talked a little bit about your undergrad and what you got there. So we're a research group. Now, how did you get into research? Did you do any research in your undergraduate degree or was that just mainly just graduate studies?
I don't know where it says in my resume that I do research. Because I don't. I'm still department head at St. Paul's Emergency, and we have a very, very active research program. We have one of the top research programs in the country in terms of emergency medicine, and we have 3 or 4 PhD MDs in our group, and tons of research comes out of us. So I support research a lot, but I'm not academic really at all myself.
Okay. Yeah, but you're a great facilitator, I'd say. Eh?
Yeah. And I work in an academic hospital, so I know a lot about research. I just don't publish or don't do studies myself.
Did you do any other hospitals before St. Paul's, or did you?
Yeah, I worked. I worked at a few hospitals in Vancouver. I've mainly been, I grew up in Vancouver, and I worked in Penticton, which is a smaller town in interior BC, for about 6 months. That's where I started my emergency medicine. But ever since I've worked at hospitals in Vancouver, I've worked at most of the hospitals at one point in Vancouver.
Great. Yeah, that's amazing. So how do you like the teaching not only the teaching hospitals, but the research aspect of it? Is that kind of a creative environment where like people are always asking questions?
Yeah, it's a little bit inspiring, because we have such an active research program and teaching as part of an academic hospital. It means that we, are somewhat on the cutting edge of new practices in medicine, and our rounds are always very interesting because some of the things that get presented at our rounds comes from our own research, and we participate in research studies and enroll patients, and
amazing.
So it adds a whole other dimension to the clinical work. As I said, I'm an administrator and a clinician. I'm not a researcher, but because I work in that environment, I get to participate in the research.
Right. But you also do some of your own research for the books you write as well, right?
Yeah. Okay.
Yeah. So do you see?
Definitely do that kind of research, but it's but it's fiction. But it's really important to me in my books. Medicine is my gimmick, and it's very important that I get it right. You talked about the last high, Jameson. I worked, at same where I work is one of the epicenters of the opioid crisis, and I've seen, I know that world inside and out. And we have one of the cutting addiction programs, and one of the cutting edge addiction programs in the world at St. Paul's, out of necessity, because we have so many opioid dependent users, and we've seen so many of them die over the past few years. So it was very important to me to be extremely accurate about the dangers and of the opioid world. And then, but what I didn't know is I know you're probably not necessarily far enough in the book to know, but there's a huge criminal side. I explore the whole criminal side of where the opioids come from in
Oh, wow.
what the underworld is, who supplies them, and all the gangs. And I didn't know anything about that, but fortunately I had a friend who was an undercover cop in Vancouver, and he gave me a crash course on this incredible world about the trafficking and drug supply world of opioids, which is multi-ethnic and violent and stupid and awful. And
Your little tidbits of information that you just mix in, and it's like, for example, if you walked in a room with a patient, you're explaining the drugs that you're pushing, and you're explaining why and the reasons why. And not only that, like the responses in their body and what's going on in almost like, that's almost like what's going on inside your head, like the author. And then it's like a whole dynamic of like, you really see yourself and your own style of writing in it. So those little tidbits are,
thank you. Yeah,
are
that's
phenomenal.
what I mean. That's the kind of sort of stuff James, I was kind of alluding to in terms of the teaching. You don't want to insult, and then you have you have colleagues and healthcare professionals like yourself who are going to read the book, and they don't want to be insulted by your description, and you don't want to talk down to people, but you want to keep it in terms that people will understand. And it's often terms how I learn new stuff, so that it's simple but not condescending, and that people can learn why a heart drug works, or why somebody with an opioid overdose stops breathing, or why just stuff that I think I would be interested in if I was in that position. Which right away to it really has impacted the research. It's been very hard to do studies and stuff with COVID. A lot of research across the world, apart from COVID, research has been suspended because it's hard to carry on. Like everything else, COVID, the way it's same way it bumped elective surgery and everything else.
Yeah.
But at our hospital, we did some big studies on we joined, it was a multi-center trial on looking at the people we were swabbing for COVID, looking at the risk factors, following up on the rate of positivity, following up on which symptoms were most likely associated with COVID and stuff. So we participated, we enrolled hundreds of people in that study. So that's about the only COVID related study that I know that we participated in. And one of the mistakes with research is people bite off more than they can chew. They have these grand ideas that just aren't practical, right? I think you need to work on small steps and build up to, coming up with a vaccine for COVID will be a challenge for you guys, but to do a simple study in the nursing home about, falls or safety or whatever is very doable. So
yeah, definitely. I appreciate that.
and I have to say, I've worked in emergency medicine for 25 years. I have worked with so many amazing nurses who, I don't know of another medical profession. I'm sure there are medical specialty. I know there are probably some where you work so closely with the nursing staff as you do in emergency medicine. I mean, last night and tonight again, I'm on with 25 nurses who I will interact with, each and every one of them during the shift, and it's and we have such a good, one of the things that's so great about our hospital is we have such a good relationship between the medical staff and the nursing staff, and the nurses are very involved in the advancement and development of our department. It's very much a collaboration. There are lots of cases of people who have, for instance, some of the geriatric patients, we've had a few who have the virus in their lung and have obvious pneumonia, but they have no virus left in their so the swabs keep coming back negative, even though we know they have COVID. But for the most part, and the sensitivity is anywhere from 70 to 85%. So you do miss people for sure, especially the less symptoms you have, the more likely, or the less viral load you have. But in terms of just general technique, the best catch-all to do it is the nasopharyngeal swab. So.
Okay, thanks for that. Yeah, again, thank you so much for responding. I was taken back by that, and you're an amazing guy.
No, I'm inspired by what you guys are doing. That's great, and best of luck. And yeah,
thanks.
I think you guys will work it out, and you're doing something good here. So
thanks. Pleasure. Hopefully we can stay in touch moving forward. But thank you, Dr. Kalla. I really appreciate it. Thanks a lot.
Bye, guys.
We'll see you later.
Take it easy.